Hi, everyone, and welcome to our HealthInfoNet Stay in the Know webinar series. Today, we're going to be talking about our notification tool that's located within the clinical portal. Today, we're going to go over a brief PowerPoint, and then we're going to be doing a demo in our clinical portal that will go through how to set up your notification subscriptions along with your patient panels. So let's go ahead and get started. My name is Nicole Yo-Fisher. I'm a licensed clinical social worker, and I'm one of the clinical educators here at HealthInfoNet. This is our contact information here at HealthInfoNet. We do lots of different educational opportunities here at HIN. We do in-person trainings, we do lots of webinars. We also have a HealthInfoNet Academy, which is a web-based tutorial program which you can start and stop on your own, but the training provides the same information that you would get in person as well as during our webinars. So please feel free to reach out to us at any point with any of your training and education needs. Today's webinar objectives are to demonstrate an understanding of what Maine State's Health Information Exchange is, which is us here at HealthInfoNet, understanding and navigating what the clinical portal is, and in particularly having that focus on our notification services tool, which is embedded within the clinical portal. So to give you a little bit of background around the HIE history, the concept was first developed in 2001 by the National Committee on Vital and Health Statistics. It was then transformed by the High-Tech Act of 2009. And now currently with the U.S. Department of Health and Human Services, it is maintained by the Office of the National Coordinator for Health IT. So we here at HealthInfoNet do work with the ONC on a regular basis in regards to the clinical data exchange standards, certification requirements, and policies nationally for HIEs. How does the HIE work today? So at HealthInfoNet, what happens is we work with our participating organizations who have a bi-directional connection with us. So not only do they view our data, but they send us data. So we work with vendors, EHR vendors with each organization that participates that sends us data, and get ultimately when you think about it, it's almost like a light switch. We turn that light switch on technically where we can receive that data from that EHR system. We work with lots of different vendors, so each vendor has a different setup for how their records look. So we take all of those different pieces of the data, we standardize it, we aggregate it, and we make one patient record for each of our patients in the clinical portal. And so when you go to view the data in the clinical portal, that information that you get, say an emergency department record, would look similar to that record you would get if you had reached out to that organization's medical records department. So everything is standardized and looks exactly the same. Here are some common clinical users of our services here at HealthInfoNet. As you can see, it does vary widely depending upon the organization who is participating with us. And this is just a small amount of folks that are using the clinical portal. Benefits of using the HIE. So when you think about how does this apply to your work and your role at your organization, what's great about the clinical portal is that you're able to access data in real time that will help you not only make informed decisions, it will help with patient safety, which is obviously very important to all of us who work with clients. You're looking at fewer repeat testing and procedures. You're looking at efficient discharge and referral management functions, being able to help with those transitions of care, fewer medical record errors, and most importantly, when you think about too your time and the energy it takes to complete a paper workflow consent form with a patient, have them complete it, then fax it to an organization that you're looking to get information from, have that medical records department process it and get it back to you, can take quite a bit of time. And that's time that you're missing out on the information. That's time that a patient may have to wait in order to develop a particular treatment plan with a provider. And so it's really important that that's a very efficient process, and it's saving everybody a lot of time to be able to log into the portal and view that real-time data in the moment with a patient as a provider. So common clinical interventions, as I mentioned, those transitions of care. So being able to follow up from an ED visit, being able to follow up from a hospitalization, being able to sit at your primary care's office and have that medical assistant or provider look at any recent labs that you've had, radiology reports. Have you gone and seen a specialist, which would help too with managing chronic conditions. Being able to do med reconciliation with our medication data, seeing if there were any gaps or overuse of medical care. Is somebody going and getting lab testing on a more frequent basis, even though they just had this similar lab done a month ago? So being able to see where those gaps and overuse are happening in medical care, and really saving time and money for providers and patients. So what is HealthInfoNet? So we are, as you'll hear me mention, HealthInfoNet, some folks refer to us as HIN. When you think about the Health Information Exchange, that's also referred to as an HIE. So we here at HealthInfoNet are the state's HIE. We are very lucky here in the state of Maine. We're definitely in the top states, one of the top states that has a high-performing HIE. And so what that means is that we're lucky here in the state that not only do we get statewide data when it comes to general medical information, we also get behavioral health information. Some states don't have a program that looks like that. Some have just county-based HIEs, which may only have general medical information. Some HIEs just have mental health information. Sometimes those HIEs within one state may not even talk to each other. And so we're very lucky that we are able to have the system that we have here in the state of Maine. There is, which is really important to know, that the state does have a state law that governs what we do here at HealthInfoNet, and that there is an informed patient consent process, which all participating organizations are aware of and know about their responsibility to inform clients of their choices, which does mean that patients can opt out of HealthInfoNet at any time and can just complete an opt-out form. They can call us here at HealthInfoNet to do so, but that is obviously of the patient's choice to determine that. There is also a statewide Maine state law that governs the behavioral health data or the mental health data that we have in the clinical portal. So that's something also to make note of. Here at HealthInfoNet, we are independent and a nonprofit. We do have a board of directors and have advisory committees. Our board is made up of medical providers, public health organizations, patients, government agencies, and various businesses throughout the state. One of the great things here about HealthInfoNet is not only do we have our clinical portal, which healthcare providers and users can use, we have the event notifications, which is obviously what we're going to be talking about today. But we also do public health reporting and have a predictive analytics and measures tool that folks can use as well. HIE participants here for the state. We have about 790 plus providers across the state that are connected to us. This is just a handful of the types of connections that we have, but we are connected to all of the healthcare systems, acute care hospitals, and critical access hospitals. We do have a VA connection. We have ambulatory facilities and FQHCs. As I've mentioned, the behavioral health, but we also have post-acute care and long-term care facilities, labs. We do have pharmacy data from SureScripts and from MaineCare, and then most recently, we now have Maine EMS data. This is just a look at some of the data sources that we have in the clinical portal. I won't go into all of these, but this is just a slide for you to see that. This is also just a great stats slide here for the month of January, taking a look at the patients accessed, as well as the number of real-time notifications that folks received. We do have main CDC alerts for syndromic surveillance and immunization reporting. And one thing to note too is our 1.43 opt-out rate. So we do have a very low opt-out rate, which means that there is a lot of data for folks, users to view in the clinical portal. So our notification service, which we are going to get into right now, I'm going to go in, we'll do the demo in our test environment in the clinical portal, which contains no PHI. But basically what we're going to be talking about today is, one, how to set up these real-time notifications, which you can get as they're happening, and you can also get daily summaries of events of care that are going on with your patient. And also to note here that this can also be really helpful for a lot of different organizations, but in particular, those who participate in ACOs or other risk-based payment arrangements, to help with any repeat testing and hospital readmissions that might be denied for billing purposes. This will help alert you of those events for your patients. So before we actually get into the demo, I'm just going to go ahead and do a little plug for our upcoming Q2 webinar events that we have. So in the month of April, we're going to be doing a HealthInfoNet Behavioral Health Use Case and Interventions webinar, which will have a little bit of that behavioral health focus and lens to that particular webinar. In May, we're going to be looking at an overview of HealthInfoNet's connections and processes. So that will be really interesting for folks that are looking for a little bit more information around our connections. And then in June, we're looking at doing a clinical portal help desk and auditor role webinar, which will help those folks who have those particular types of user accounts. So we do have a user accounts for help desk, which means that folks at each organization can have a help desk account where you can create and remove accounts for your organization. You can help with password resets. And we also have an auditor function, which means that each organization you can have an auditor who can audit users' usage of the portal and to make sure that folks are going into the right patients for the right reasons. And so that will be occurring in our June webinar. So if you're obviously looking for more information about these webinars, please go ahead and go to HealthInfoNet.org, where you can find all of that information and how to register. We have a great website, has a lot of different information. So go ahead on and check that out. So right now, I'm going to go ahead and open up our test environment. So as you will see, this is the demographic search screen for the clinical portal. One thing I just want to make note, there's lots of different ways that you can add your patients to your patient panel for notification. So we're going to get into that in a little bit. But right now we're going to go to the notification section here in the menu bar. You're going to see the My Patients, which is the patient panel. Sometimes I refer to that, the My Patients. You're also going to see My Subscriptions. The way I educate folks on how to set up notifications is really starting with your subscriptions first. So that's where we're going to start right now, is looking at the types of notifications that you want to receive and then how you want to receive them. So we're going to go ahead and start with double checking the email address here up at the very top. So what's important about this is that it should default to the email address that we have for your user account. But I always just tell folks, just double check, make sure that that's accurate. That's where you want your email notifications to go to. You're going to see by default that the notify in real time email and the notify by daily summary email are checked off here. So that's also important. Those options are there. And then let's go ahead and get down to the notification section. Okay, so you can obviously see here the different options for notifications. The ones that I will point out to you that are more used by users are the inpatient admission and discharge and the admit and discharge from the ED. Those are obviously the more popular choices. We do have a radiology report available and laboratory result available. Those are also pretty popular as well. So let's go ahead and think through some of these subscriptions. So if we're looking at sort of these most popular ones that folks use, what you're really going to want to do is think about your role at your organization, think about your workflow for your day, how you interact with your patients. So thinking about it from, say, a case manager role. So if you're a case manager, you're working in the community with your clients, you have clients who might be high utilizers of the emergency room, and you have been working with them on having a safety plan where they are to access other avenues of support prior to going to the emergency room. So one thing that you might want to consider is if you have a smaller patient panel of folks that you're following, and you're working out in the community with them, you might want to get an email notification that somebody's been admitted to the ER. Once you click on that, you're going to get some delivery options that will pop up for you. So in this example that I'm using, I'm going to click on this change button here that's hyperlinked, and it's going to ask me, do I want to get this in real time or do I want to get this in a daily summary email? Real time is exactly what it means. You're going to get that email in real time as that ED registration is occurring. So once somebody sits down in the ED, they get that registration encounter that is populated, then you're going to get that email that somebody is sitting in an emergency department throughout the state or somewhere within the state. So if you're that case manager and you know that a patient is showing up in the ED, but that's not what they're supposed to do, they're not following their plan, you might want to go to the ED and sit with them in the waiting room, discuss their plan, and maybe discuss if there are other opportunities or options available to them in the moment. So this is a good example of being notified in real time. So you might want to click on real time, or you might want to go and be able to sit with your client. If they are sitting in an emergency room, you might want to sit with them and advocate with them and for them and to know what's going on. So that's just one use case. Once you do that and you decide, okay, this is the type of notification I want to get for my patient, I'm going to go ahead and click OK. Say you are working as a nurse care manager in the primary care setting, and it's your job to follow up with folks after they've been discharged from the hospital. So for this example, we're going to go to inpatient discharge. We're going to click this checkbox, and then we're going to go to our delivery options. And we decide here where each morning you want to get an email of your patients that have been discharged from the hospital so that throughout the day or throughout that morning, you can follow up with them around that event of care, around that hospitalization, make sure they have an appointment scheduled with the appropriate amount of time for follow-up. You want to make sure that they got all their discharge medications. So it's here that it makes more sense if you have a larger patient panel of folks that you might want to get that daily summary email. So you're getting a list of all of the patients in just one email. And we'll go through at the very end and show an example of what that email notification looks like and how to search for your patients depending upon the information that you got from that email. So we're going to go ahead and click Notify in Daily Summary and click OK. For either one of these, for any one of these notifications, something to think about. You can get both real-time and daily summary. That might mean a lot of emails for you. You might get really eager and excited that you can get these notifications and you want to follow up with your patients and you decide you're gonna get everything. You might, in a week or so, after you've received a lot of emails, say, oh, you know what, this is a lot of information and I'm gonna wanna go in and I'm gonna wanna change the frequency to which I'm getting these emails. You can come in at any time to this section of My Subscriptions and change the delivery options to your emails. And once you go through and make that change and you click the Save button, that's going to be saved, and that will automatically change as soon as you click the save button. So that's something to think about. You can come in at any point and alter it as you see fit. And it is something where I think at first you're going to want to get a feel for the notifications and the frequency to which you're getting these emails and decide what is most appropriate for you during your day with your workflow and how you have that patient interaction with folks. So you obviously, you could take the time and you can go through each of these areas that are applicable to you, where it makes sense that you are going to want to get, say, some lab results, but you might be doing that as a daily summary email where you just want to follow up throughout your day. Now, the daily summary email is consisting of information that has occurred from the previous day. So you get that daily summary email in the morning, and it's from the previous day's events of activities, depending upon the type of notification you're receiving. So that's also something to think about. So another notification that I always do highlight is patient deceased. So you can get that information for your patients. It is obviously only going to be those patients that have passed away in the hospital. So we're obviously connected to all the hospitals in the state. If it's occurred in the hospital, then you would want to get that. You would be getting that notification if you chose so. So that too could be something that you want to get in a daily summary email. So I've come in, I've made all of my choices and decisions that I want to make. I'm going to go ahead and, very important, you're going to want to click that save button. So it's going to save all of your choices here in this section. Now the next part is to go to your My Patients and determine the patients that you want on your patient panel. So obviously here I've got a lot of list of my test patients, so I have a lot going here. What's really nice about the My Patients panel here is that it's very easy to add and remove your patients from this list yourself. So if you have a very small amount of patients, we usually say around 100 or less. If you have 100 and more patients that you want to add to your patient panel, that's when you want to reach out to us here at our customer care. It's customercare@HealthInfoNet.org. That's the email address. That's our customer care team. You can always reach out to myself too, and we can get you connected with those folks. But our customer care team can work with you if you have those 100+ patients on getting an Excel file with you with the information that we need, and then we can automatically load those patients for you in your patient panel. Once you have that initial load, bulk, what we refer to as a bulk load notification, once you receive that, it is definitely very easy for you to add and remove patients on an ongoing basis. You can continue to work with us and our customer care team as well, but we have made a lot of enhancements to this tool that make it very easy for you to do so on your own and at your leisure. So I'm going to go ahead and show you how easy it is. I'm going to search for my patient, Donald Duck here. I'm going to just type in first name, last name. So very similar to our demographic search in the clinical portal. I'm going to click the search button. It's here, obviously, that I would want to know my Donald Duck's date of birth, so I know I'm selecting the right patient to be added to my panel. So I come down here, and this Donald Duck from Gardner, that's my patient. I click on the green check, and that Donald Duck is going to be automatically uploaded here to my patient panel. If you decide, or you're going through your patient panel, you know you've had some patients that have left your practice and you no longer want to receive a notification on them, you can just come in here, you click this red X, you're going to get a warning or a pop-up screen that's going to ask you, are you sure that you want to delete this relationship? You click OK, and then that patient is easily removed from your patient panel. If you have a very long list of patients and you're trying to search specifically for it, that particular patient you want to remove from your panel, then you want to click in this box here that says Search Patient Panel, and you start typing in your patient, and it's going to start pulling in all of the patients given what you're typing. And then you can obviously see here that we are getting the Minnie Mouses that we're looking for. And oh, this Minnie Mouse here from York Hospital, I'm going to delete off of my patient panel. They're no longer my patient, and it's super easy to be able to do so. Another way to add a patient to your patient panel is actually within the record itself. So let's go ahead and in my menu bar here, I'm going to click on the demographic search screen or button area here, and I'm going to start typing in my Minnie Mouse. Whoops, I spelled mouse right, Minnie Mouse. And I'm gonna go ahead and I'm gonna open this Minnie Mouse here. I did a training earlier this week and used her for my example. So this Minnie Mouse from Sacco is my patient. I've had that record open before. I come in, and as you can see in the patient summary screen, there's different tabs here. There is a tab for my patients. So if I click on my patients, it's gonna pull in that same my patients that you saw when we were in the notification section, but this time it's pulling in the necessary technical information for my patient, which includes site and MRN. The tool automatically does this for you, so you don't need to alter site or MRN. You don't need to touch these areas. All you need to do is click Add Relationship, and now that patient is in your patient panel. So as you're going about your day and you're in your workflows that you're already doing when you search your patient records in the clinical portal, you can easily always add a patient to your patient panel just by being in the record itself. So that's something to make note of. I'm going to go back here to the patient panel and notifications and show you a few more things. So another neat thing about this tool is the fact that you can always come in and add end dates to notifications. So if you are working in a specialty area, specialty provider, say you are working in orthopedics and you follow up on patients who have come in for hip replacements. The patient has come, had their hip replacement. They come from all over the state. And so you want to know when they go home and they leave the hospital, you want to follow them for a 3-month, 90-day period to make sure, you know, have they had to go back into the hospital? Or are they going to the emergency room? And so that's your process, is that's how you follow them. What you can do is you can add an end date where after that 90-day period, you can stop receiving notifications on that patient, and it's just for that particular period of time. You do that by clicking on this pencil here. And once you click on that pencil, you click within this white box here and a calendar is going to pop up for you. It's here that you can come in and adjust the dates here to the time period that you want and add an end date to that patient. Now, one thing to make note of is after May 27th of this year, I would stop receiving notifications on my patient Mickey Mouse, but he would still remain on my patient panel until I went and deleted him off of my panel. So that's just something to think about and remember for the future. One thing you can do too is you can always edit all of your end dates for your patients here. You can also clear all end dates for your patients too by clicking on the clear all end dates. And there you go. One of the next thing we're going to go and talk about is one of our newer enhancements of notifications. This is a tool that you will see here. It's under Show Notifications. There's this button right here. If you click on that button, what's going to happen is you're going to see your list of notifications that you have received in the last 30 days. So rather than managing your notifications that you are receiving over the past 30 days through your email, you can actually get a list of those notifications here. So this is much easier, a little bit more user-friendly than having to copy and paste medical record numbers and informations from each individual email that you're getting for your notifications. Another great aspect of this new enhancement is the fact that you can get all of this information and you can export it into a CSV file in Excel. So we're going to go ahead. We've asked to put all of that information into Excel, and you're going to see this Excel file here. My poor test patient, Albert Notifier, he goes to the ED every hour, so that's why I have all of my notifications on him. But it's here that I can get, obviously, when my notification was sent, the patient that I'm receiving the notification on, the medical record number, where it occurred, and the type of notification that it is. So whether your patient went to the ER, whether they got discharged from the ER, went to the hospital, got labs, radiology visits, so on. So what this is really helpful with is if you are in your organization, you're the one that gets all of the notifications, and then you disseminate that information to coworkers. Now it's much easier to get your list of notifications, export it into that CSV. You can sort these. So if you're getting different types of notifications, whether it's ER, hospitalizations, you can sort by them. And then you can send this information or share it very easily with your coworkers, just by having it here in a CSV, where it's much easier to manipulate and sort through. So that is a great new feature that we now have in the tool. One other great thing to make note of is the fact that if you've gotten a daily summary email for your patient, if you come down to your email subject here, you're going to see this hyperlink that says daily summary. So if you get that daily summary, you are then going to click on that hyperlink, and you're going to get your list that occurred within that daily summary. So this is also a new feature and new aspect. You can also export this information into a CSV at any time. You can search for notifications by clicking in the search notifications white box here. And another thing which is also much more user-friendly is the fact that not only can you view the types of notifications you've received on your different patients, you can also click on this medical record. This is also a hyperlink. And that by clicking on that MRN, you can actually get right to who that patient is and be able to open the clinical portal record and get more information about that event of care just by using a couple of clicks. So if you haven't opened that patient record within the last 72 hours or 3-day window, you would need to break the privacy seal as you normally would with any patient. It just so happens that I've opened my patient Albert notifier within the last 3 days, so it's available for me just by clicking on it. But this way I could come in and I could view any of the documentation or any of the information in the patient summary screen about that event of care. I can always get back to my patient panel by clicking on my patients, or by going through my menu here and getting back to that same area. So this is much more user-friendly than we have had in the past. It's a great enhancement, a better way to manage, and you can go back to your showing relationships at any time. You can go in between that show notification, show relationship at any point and look for your patients. If you are managing your patient panel by email, I just want to show you what an example of a notification email is that you would get. So here are just a couple examples of the daily summary email and the real-time notification email. As you can see, this is just a sample. There's no PHI except for the fact that you will get an MRN and a location of where that event of care occurred. So you can see you would need to know, okay, my patient went to Midcoast, and this is the medical record number that I would need to copy. You can easily copy and paste, go in and search for your patient. I'm going to use the example here of the real-time notification. So here in the real-time notification, it's a single notification with a single patient information. It's telling you that your patient that you identified with this particular medical record number was admitted to the emergency room at St. Joseph's Hospital on this date. So what I would do here is come in, I would highlight my medical record number, I'd copy that. We're going to go back into the clinical portal here. We're going to go to demographic search. And if you've been a part of our trainings before, you'll know we don't often speak to needing to search for patients using facility or MRN. We always advise folks you're really using these bottom 4 categories: first name, last name, date of birth, and zip. But it's here with the notifications that you actually, this is where you use the facility and MRN. So I'm going to come in here and I'm going to remember St. Joseph's Hospital was where the event of care occurred. Medical record number, I've copied that. I'm going to paste it in there. I'm going to search, and I'm going to get to my patient here. It's going to pull it up for me. Still breaking the glass if you haven't opened that record in 72 hours, and then you open that patient record and can look into that event of care documentation and information. So that is basically the notification tool here. We will have user guides available on our website, and those folks that attended the webinar today will get that user guide that will go through everything I went through, so you don't have to remember everything. But it is very user-friendly. It is very intuitive. There isn't anything you can add or delete, obviously, except for the patients that you put in your panel and any changes that you make to my subscriptions. But it is very user-friendly to use. So please always feel free to reach out to us with any questions that you have, any concerns that you have. And as I mentioned, if you are looking to bulk load your notification patient panels, please certainly reach out to our customer care team, or you can reach out to me individually, and we can get you connected to the folks in our customer care department. Thank you for listening to our webinar today. We really appreciate you being here. Once again, please head to the website for more information on our webinar series that we have coming up in the next few months in April, May, and in June. Thank you again.